My name is Arshia Wajid, and I'm the founder of American Muslim Health Professionals. I started AMP about 14 years ago. The idea behind AMP was simply to create a platform for Muslims who are working in diverse sectors of healthcare to come together for professional development reasons, but more importantly, how can we come together collectively to leverage our skill set, our educational background, and our expertise to work on public health initiatives for society. When it comes to really having a voice at the table and policy making and advocating for the rights of uninsured and minority communities, prior to AMP, there really wasn't a single national organization of Muslim health professionals doing this. From that standpoint, I think it's really critical that we have a voice in advocacy and in policy making to make sure that individuals who don't have access to health insurance, whether they're refugees or immigrants or minorities, that we as Muslims are playing an active role in making sure that they have a voice at the table. There needs to be a lot of focus on mental health in the Muslim community. Obviously, there's still a huge stigma around this issue. And so over the last few years, we've taken on a few different initiatives. One has been on creating Muslim youth identity events, where we showcase 3 youth who, in spite of discrimination and prejudice, they have still been able to, do some amazing things. In 2015, AMP partnered with Muslim Wellness Foundation to do a mental health first aid training in Washington, D.C. So the idea behind these trainings is to determine what are symptoms and what can be done as first responders to identify mental illness and see how they can be addressed. The saying that goes in terms of from whom much has been given, much is expected, it is something that's very true, and I do feel that every single one of us, that we have something that we can use to give back to society. I wanted to thank my family and friends because without their support, there is no way I would have been able to make it this far. And also wanted to thank all AMP's previous and current board members and staff and volunteers. Coming up with an idea to start an institution, an organization is not that hard, but to really build it and see it grow, it can only happen with the hard work of so many individuals. And also to our donors who really believe in AMP's mission and vision and recognize the importance and value that this organization brings. And last but not least, I want to thank MWA's board and staff as well for recognizing me for this award.